Have you ever heard of leucovorin? It's a drug that can help some non-speaking autistic children start to speak within days. Leucovorin is derived from folic acid and it's commonly prescribed to cancer patients who are undergoing chemotherapy to prevent some of the side effects from chemotherapy. There are several studies that show huge improvement in autistic children. One study, after just giving 2 doses of this drug, the children began to improve in receptive and expressive language use. Some autistic children have blockages that prevent the transport of folic acid to their brain, and it's thought that this drug helps bypass that blockage so that folic acid could be delivered to the brain. Some children did have adverse events as a result of taking this drug, specifically children that were concurrently taking antipsychotics such as risperidone. They showed increased aggression and self-injurious behavior. It's theorized, however, that it was a lactose additive that might have caused that reaction, and when they redid the test without a lactose additive in the drug, they did not find any adverse events. Hyperactivity and agitation were commonly reported in the first few weeks of taking it, but in the placebo groups, they also experienced hyperactivity and aggression. The treatment groups did see a taper off of the agitation and irritability at about the 6-week mark. So they had an increase in irritability for 6 weeks, and then it drastically decreased, whereas the placebo group kept increasing in irritability over time. So what they're theorizing is that this drug might actually replace antipsychotics in treating irritability in autistic children as well. Up to 75% of autistic children may benefit from this treatment, and you can figure out if your child might benefit from it by having them do a folate receptor autoantibody test. This drug is not yet FDA approved for the treatment of autistic children, and it is currently undergoing larger trials at Phoenix Children's Hospital, Emory University, and the Lurie Center at Mass General Hospital.